Sodium nitrite, it is commonly available as a generic, so no real trade names on this one either. This is used for cyanide poisoning antidote. It is part 2 of 3, so check out the amyl nitrite first and then come view this. Way it works, it's pretty similar to amyl nitrite. We just give it IV versus inhaled. So it converts hemoglobin to methemoglobin, which then binds with cyanide in the blood and renders it inactive. Cyanide prefers methemoglobin over other cells, and so that's why it binds to it real well. Pregnancy class for it is C. The only thing we use it for is cyanide poisoning. Contraindications, there's none really in the emergency setting. You gotta give it, you gotta give it. Adverse reactions we need to be mindful of. Hypotension and tachycardia can cause syncope, nausea, vomiting is possible, and it's also possible that causes methemoglobinemia. And so that's going to be cyanosis of the lips, fingernails, and or palms of the hands. Drug interactions, there are none really to note. Typical adult dosing is going to be 300 milligrams, slow push IV IO, and you're going to give it over about 5 or 10 minutes. For the kiddos, it's going to be 10 milligrams per kilogram, again, over 5 or 10 minutes, IV or IO. Starts working within a couple minutes usually. Peak effects varies, and it stays in the body working for 30 minutes to 2 hours. Something to keep in mind whenever we're giving this, it's going to be IV, of course. A lot of times we'll give amyl nitrite first inhaled if a person's unconscious until we can get our IV established, and then we'll switch over and start giving this. And also, after 30 minutes after we've given it, if we're still having a lot of signs of cyanide poisoning and stuff, we can give half of the original dose. We'll give sodium nitrite and sodium thiosulfate and repeat that dosing if necessary.